Hello, my friends. Welcome back to Forever Young. Kerry Anwser here, along with Kelly Capasola, and we have a special guest today. Dr. Chris Kammer is our guest. He's been a progressive voice in dentistry for more than 2 decades, seeking out emerging technologies and approaches with his work that involves the oral systemic approach. That's a recent movement in medicine and dentistry that improves general health by optimizing our oral health. He's also helped many of his patients to gain increased resistance to chronic disease, including heart disease, stroke, diabetes, even some types of cancer, and Alzheimer's. You can include in that as well preterm birth and obesity. Dr. Kammer works to alert all of his patients, but especially the kids. Here's the formula. Brush, rinse, chew, and smile when it comes to xylitol, oral care products, and improved dental and overall health. We've got a great show lined up today, as you can see. Dr. Kammer, thank you. On behalf of Kelly and myself, really happy to have you today on Forever Young.
Well, Kerry, thank you, and hello, Kelly, as well. And I think for those that think they know their teeth, they know their mouth, they feel they have good dental care, and that's enough, they might be surprised by some of the things they hear today, because I've got some information that is not commonly known in dental circles, and we're trying to get that out among dental professionals and to the public at large, because it's so very important.
Oh, it's very, very important, and I think listeners are going to walk away from this show being like, whoa, I didn't know it mattered that much, and you're going to do it in a fun way. That's the great thing. Dr. Kammer, I've had the pleasure of seeing you speak on several occasions, and you truly have earned the name, the Rockin' Dentist. So excited for our listeners to get a sneak peek about who you are and all the great accolades that you've done with research and different backgrounds to share. So why don't we start about what's going on in the world of oral systemic dentistry?
Well, I think, when I got into dentistry, I sort of figured, this would be an area I could go into, which is, medical, but I don't really have to worry about life and death. I guess I was trying to at one point think, should I, go into the medical realm? Should I become a doctor or should I become a dentist? My father was a dentist, God bless him, and he was amazing. He started the American Academy of Cosmetic Dentistry, and so I was definitely influenced by my father. And I also thought, dentistry seems nice, it's not so life and death. So I chose dentistry, and I'm thankful that I did, because it's very exciting. It's probably one of the most exciting professions out there right now, especially in the health realm, which I'll explain. But the longer that I was in dentistry, the more I realized, oh my gosh, it is about life and death. And that's what I'm really trying to wake up the public and the dental profession to, because what goes on in the mouth, and this all makes common sense, but if you have disease in the mouth, it is absolutely connected to your whole body, and it impacts your whole body health. For some reason, somewhere along the line, somebody separated dentists from doctors, and the two never really spoke much together, as if they were two completely, separate realms that didn't even intersect, and that couldn't be further from the truth. So it's great to be talking about dentistry and to be in the dental realm these days, because it is so closely enmeshed and connected to our whole body health. This is what has been mind-blowing to me over the last 6 years that I've been involved with the American Academy for Oral Systemic Health.
Doctor, you mentioned cosmetic dentistry. I wonder, if you go in, and let's say you need to have a lot of work done to improve the appearance of your teeth, does that necessarily do anything, again, to help with those types of oral systemic difficulties that you're talking about that are related to some type of dental problem?
Cosmetic dentistry is all about doing what it takes to get a beautiful smile. In my practice, I never want to put that ahead of the healthy mouth. In other words, you really want to establish a healthy mouth before you do the elective cosmetic enhancements of the mouth. So they are two kind of separate entities. They can go hand in hand, but I wouldn't do cosmetics without having the health of the mouth as a factor, most important, number one.
So it's kind of like doing something to take care of an outward appearance, but not necessarily the root cause of what could be causing other problems in the body.
Kerry, let me put it this way. Here's, a lot of people go in and get their teeth cleaned every 6 months, right? And yet we know that approximately 80% of the population, of the adult population, has gum disease, has had it or has it now. And once you have gum disease, it's not something that you can really cure. You have to maintain your mouth so that you don't continually have it active and getting worse. And so my concern is that most people go in, 90% of all insurance claims are for these 6-month cleanings, meaning that that's supposed to prevent you from having disease. But if 80% of the population has gum disease, and any dentist will tell you that how many of your patients will bleed when you clean their teeth? And usually they'll say, it's in the 80 to 90% range. So if you're going in for a cleaning, which is a 6-month cleaning, for a lot of people, that's just the dental team polishing the disease. And I find that unacceptable.
When we talk about this, I think a very important part of the equation is when it comes to the oral systemic realm of dentistry, it can often offer ways to help detect serious medical conditions. Tell us a little bit about that.
Well, I tell you what, any doctor will tell you that at the root of all systemic disease, is chronic inflammation. Chronic inflammation contributes to cancer. It contributes to atherosclerosis, which can lead to heart attack and stroke. It contributes to diabetes. It contributes to arthritis. And I could go on and on and on. The most common area in the whole body with chronic inflammation is the mouth. That is, by the way, the most common area. So with the most common area of inflammation in the hands of the dental profession, the actual first place to start to get chronic inflammation under control would be the mouth. Now, you have chronic inflammation, that can make you, what should immediately be a concern is this someone that could be at risk for diabetes, which is like there's an epidemic going on in the United States right now, and it's expected that by the end of this decade, fully half the population will either be pre-diabetic or diabetic. This is out of control. Well, we can screen for patients with diabetes if we notice they're bleeding chronically inflamed gums. Folks, if you're finding bleeding at home, you might not even need the dentist to tell you that if you see bleeding in your own oral care practices, whether you're brushing, flossing, or even biting into an apple. Oh, my goodness. So getting it under control is probably the most powerful message I could leave with your audience today. And when they go to the dentist and they're told to floss more, this is a common problem. I'm going to go back to like so many dental offices are polishing the disease. In other words, you go in for your 6-month cleaning and they polish your teeth, make them feel smooth and all looking good. What you want to ask is, well, was there any bleeding? Were there any points of bleeding? And if they say no, then you'd go, okay, good. If they say yes, which they would say yes, as dentists have told me from across the country, in 80% of the cases. So quite likely your hygienist or ask the hygienist and ask the dentist. And if they didn't probe to check that, if they didn't take that little measuring tool and measure 6 places on each tooth, then they don't know if you're bleeding or not. They don't know if bacteria is hiding in places where the brush and floss can't reach. So you really need a thorough exam, and you need 6 measurements at each tooth. If they didn't do that, ask them why they didn't do that. But if they did find bleeding and they say, yeah, we found a little bleeding, then you would say, well, is that bleeding disease? And they might say, well, it's a little. Well, if it is disease, by definition, they just performed the wrong procedure on you if you have bleeding, because that is disease, and it is no longer appropriate to do a 6-month cleaning, I use in air quotations, or they sometimes, it's called also a prophy or a prophylaxis. That's not the appropriate treatment for people with disease. So that is sort of what I'm kind of railing against. That's my concern. I know that out there in the dental community, that's what's mostly being done, and I have no problem announcing that to all my colleagues, to the ADA, to whoever will listen. They want to come at me for that. I would be glad to stand up and defend that, because all of the dental professionals that I talk to tell me that's the case. They don't know what to do with the bleeding. That's the problem. That's part of what the American Academy for Oral Systemic Health is all about, and my approach to it, which I call gums of steel. If you want to have healthy gums, you want to have gums of steel like as if you were the man of steel or had abs of steel or buns of steel. You want healthy gums. You want to diagnose gum disease, and then you want to treat gum disease. I am having a very difficult time getting the profession of dentistry to diagnose gum disease, as I just described to you, which it starts with just by identifying the bleeding. But there are a lot of other clinical signs. And then there's a whole 50% of the whole diagnosis of gum disease is involved in the lab analysis of saliva to identify pathogenic bacteria. Basically, instead of saying pathogenic bacteria, I'll just say the bad bugs. The bad bugs that live in your mouth that you can't see with your eyes. And so there's no dentist in the country, in the world, that can see these bugs, and you might have great clinical signs. Maybe you don't have any bleeding, but you're only getting half of the picture if you haven't had your saliva analyzed to actually assess what are the levels of the bad bugs in your mouth, because you could have high levels even with excellent clinical signs, because gum disease, just like tooth decay, these are transmissible diseases, meaning that if you share a glass of beverage with somebody, or even a child's pacifier to give it back to the child, you could transfer your bad bacteria to your child.
Listeners, please go to our website, click on the weekly highlight page, foreveryoungradio.com. We'll be right back after the break.
We're talking about oral health, just how important it is to understand all the other issues that you're dealing with physically, how it may be related, and in general probably is related to your oral health. And Doctor, you've talked a bit about, again, the kinds of things that you think should be done with oral systemic dentistry is kind of the foundation of how these things should happen. But the medical profession, the dental profession, they're very, very slow to adopt new ideas, new technologies. And tell me, how is the battle going with oral systemic dentistry and your efforts to inform not only patients, but the other dentists?
It's a slow build. The amazing thing, Kerry, is that this science is never going to go away. The mouth will always be connected tighter and tighter and to the rest of the body as being an area that can impact and influence your overall health. I was really shocked a couple of years ago when somebody was reporting on the Today Show. Their medical reporter, of course, was reporting on a dental issue, which sort of kind of got me a little bit miffed right there. It's like, really? Get a dentist on there, at least a knowledgeable dentist, because what the medical reporter said, their studies are out that show that what happens in your mouth stays in your mouth. They sort of likened it to, it's like Las Vegas, like what happens in Vegas stays in Vegas. But they totally misreported the whole study. The takeaway was that, don't worry about your mouth, but it's important to floss and brush and all that stuff. But that couldn't have been further from the truth. What the American Heart Association said is that at the time they said, well, we can't say that it's causative what goes on in the mouth, but what we will say is there is a connection. In other words, it's almost like if I had a light switch in one hand and I had a light bulb in the other hand, I couldn't turn that light on and off without the wiring that goes between the light switch and the light bulb. Well, they're saying like the mouth is the light switch and the heart is the light bulb. And, independently, they don't affect each other. You need the wiring. Just like, well, of course, your circulatory system is the wiring that gets inflamed and gets infected and irritated by the pathogens and the disease going on in your mouth, which can lead to heart disease and stroke. So it was a very bizarre way of informing people of that study, and that just blew my mind. It made me want to jump into the TV screen or put rush down to the Today Show and say, hold it, everybody. That's wrong.
I understand that, Doctor, because I've heard that before on other nutrition topics when we've talked to people who are experts in the field, and I know that there's a difference of opinion there and another way to look at it, but it's presented differently. But back to the whole issue of why inflammation in the mouth is such a problem.
I liken it to saying that your circulatory system, your vessels, your arteries are on fire, because it's an irritant that's floating through your bloodstream. And so that is an irritant that brings out the defense mechanisms for your body and causes other circumstances to occur that are unhealthy for your arteries and your veins. And then when these bad pathogens start floating through your bloodstream, they also enhance the deposition of the fats that are floating through your bloodstream as well. They help them lay down into the linings of your arteries, which start to close your arteries down, which makes it harder for the blood to pass through, or makes the arteries bulge into the area where the blood is flowing, and then those fats can actually break through that tiny little lining of the artery, which can lead to a clot and a blockage and a heart attack and stroke.
When I first heard that news that there was a connection between dental bacteria and heart attacks, I didn't know at the time that it was the name of the study. I think it was Bale-Donine study that showed that particular link. But that was really a mind blower for me, and I imagine for a lot of folks to think there really is a connection here.
Right. For those that want to research this, you can just search 3 words, Bale, B-A-L-E, Doneen, D-O-N-E-E-N, and I would just even put in British Medical Journal because that was the study that came out. I thought it would have been on the front cover of all the dental journals, but it hasn't been. Dentistry is very slow to react to information like this, which bothers me. But yeah, this is the study that showed that these bad bugs, these bad pathogens that originate in the mouth, in other words, that's where they start out. As they flow through the bloodstream, they are impacting the three things that cause atherosclerosis. So they are absolutely causative to contributing to atherosclerosis, which is the aging of your arteries, the fat depositions that go into the linings of your arteries that can lead to heart attack and stroke. This is a huge study. This is what we've been following for years and years, and Vail and Doneen have been instrumental in the American Academy for Oral Systemic Health. And so I've been following their work for years and years. And now what's great is that they've done a peer-reviewed study that has been published in the British Medical Journal, linking a number, many studies that include over 7,000 people with gum disease, found that they're, more than twice as likely to suffer heart attacks, and that these certain bad bacteria are connected to the heart attacks and strokes. So this is no longer just a maybe. It is right now in a peer-reviewed study. It is a for sure.
Yeah, and we'll go ahead and put a link to that study on the weekly highlight page underneath the information with Dr. Kammer, so listeners can go and check that out. The more people we can have taking a look at it, the more that maybe people will understand the importance of what we're discussing today. And when we talk about bacteria in a whole, especially the dental bacteria that can contribute to serious heart conditions, heart attack, stroke, like we've been referencing, I think that's where it comes in, where we've talked about it on here for 6-7 years, is the use of xylitol. Xylitol seems to be really helping people manage their dental issues, especially when it comes to the dental bacteria. And, even starting in our children. I remember I gave my kids, the banana toothbrush all those years ago, and we've continued to use the Spry line of product. How have you seen the use of xylitol help in your practice and with managing the needs of oral care?
Xylitol is amazing. It's a naturally occurring sugar alcohol that you'll find in birch trees and vegetables, fruits. Our own bodies make it. So the amazing thing is that as a sugar alcohol, it's sweet like sugar. It does not feed the bad bacteria in our mouth like table sugar does. And so it actually, they can't metabolize it. So it does two things to the bad bacteria. Once the bad bacteria consumes xylitol, it can't metabolize it, so it kills it. It lyses, it explodes. The other thing it does is that it attaches to the outside membrane, and part of the problem with this tooth decay bacteria is that it sticks together. It's very sticky, and it sticks onto our teeth. When xylitol attaches to the outside of the membrane, it deforms it and reduces its ability to stick to one another and to stick to teeth. So my patients that are regular users of xylitol have the slipperiest, slickest feeling to their teeth. It is demonstrably noticeable, and it's amazing. So I'm always kind of surprised why the dental profession doesn't do more with xylitol. It's because they just need a wake-up call. If we can't create a knowledgeable, educated public, then things will never change. When the people demand a higher level of care, that's when things will happen. Now, with xylitol, every office should be distributing xylitol. I'm involved with the Halloween candy buyback, which has dentists across the country buying candy back from kids and replacing it with xylitol-sweetened candy that is actually good for teeth. The other thing that is important about xylitol is now that we know that the bacteria that xylitol impacts, the strep mutans, which are the first forming bacteria in plaque and this what we call biofilm, strep mutans are now implicated also in cardiac disease, atherosclerosis. In other words, once again, these bacteria that originate in the mouth are having whole body health ramifications. So xylitol becomes all the more important. And I'll say even one more thing about xylitol. My organization is trying to create dentists and dental healthcare workers that walk the talk. So we have a competition every year and we do a battery of 6 oral systemic tests, from blood tests, saliva tests. We look at their carotid arteries with an ultrasound. We test their nutritional status, right? And the winners of our last 2 years have been heavy users of xylitol. I just like to throw that in because I think it's a key ingredient in your overall health beyond the absolute benefits of using it in the mouth to disrupt the formation of plaque, make that bacteria powerless to create the acid that would cause tooth decay, and the way it can stick together to form the plaque and irritate the teeth and demineralize the teeth. So,
Xlear.com, X as in xylitol, Xlear, Xlear.com. You can link directly from our website, foreveryoungradio.com, if you go to that weekly highlight page and learn more. I mean, it's so neat. You can find the Spry dental products like Spry gum, mints, toothpaste, oral rinse. I mean, they offer something for everybody in the entire family. You can get it at Vitamin Shop, Whole Foods, Sprouts, and other fine health retailers nationwide. And also Kroger stores nationwide carry it. So you can go over to Xlear.com and check for a retailer in your area. We got to run out to a break. We'll be right back. Don't touch that dial.
We're back with more on Forever Young. Carrie Nosler here, Kelly Caposola, Dr. Kammer, our special guest today. And Doctor, you've alluded to the idea that we can do certain types of testing using bacteria in the mouth to understand just what risk factors might be present for people, and especially when it comes to heart attack. So can we test things like saliva, for example, to see if we might be more prone to heart attacks, atherosclerosis, and such?
Absolutely. Carrie, there will come a time when it is standard protocol in the dental office to have your saliva tested. The good news is there are dentists, and a lot of them, that are doing it today. A lot of these are the dentists of the American Academy for Oral Systemic Health. It's growing. And yes, saliva absolutely must be tested, because even in the medical journals where they describe what are your goals, if you have gum disease, what are the goals of treatments? If we're treating gum disease, what do we want to see? We want to get the clinical signs under control. We want to stop the bleeding, for one thing, of course, and stop the bone loss and get the gums healthy and fresh breath and all those wonderful things. Those are all things we can determine in the clinic. But fully, the other half of the picture is what most dentists are not checking, and that is the level and the types of the bacteria involved in gum disease. And as I also mentioned to your Forever Young audience, that these are the same bacteria that are implicated and causative of atherosclerosis, which puts you more at risk for heart disease and stroke. So your dental team doesn't even know that side of the picture if they're not testing with the saliva. Kind of blows my mind that the ADA, even this week, had a chance to talk about saliva testing, and they didn't do it, and that disappointed me. So, but mark my words, it'll be standard protocol in the years to come, but it's necessary and needed now. Why is it needed now? Well, we want to have healthy mouths. We want to get gum disease under control. That's the most out-of-control disease on the planet, which can contribute to heart disease and stroke, heart attacks and stroke. So we've got the most common area of inflammation being gum disease. So clearly in the dental world, why do gums keep bleeding? Why does, I think a lot of dentists are frustrated. They feel like, well, we can't get this under control. Well, are you identifying the pathogens that are present? So that's where saliva testing comes in. And it's easy. It's a simple swish and spit test. And they assess the types of bacteria that you have and the levels of these bacteria that you have. Bodies are amazing things. They're very resilient. They're very strong. We have our own natural defense mechanisms going on. The healthier you are, which are the things that you talk about on your Forever Young program probably every week, ways we can stay healthy, they help you fight off these bacterial attacks. But sometimes you can have high levels that can be floating through the bloodstream that can also affect your heart and your circulatory system. So,
what about good bacteria in the mouth?
The same principles operate in the mouth. In other words, for all the bacteria in the mouth, there are good bacteria, there are bad bacteria. and they're constantly competing for one another for nutrition. And they're going to take the sugars, the refined sugars that you eat. They're going to take, they're all looking for food, right? And so if you build up the good bacteria, and you can do that specifically with oral probiotics, which are different from the gut probiotics, but there are probiotics designed to build up the good bacteria in your mouth. And once again, you wouldn't just swallow that. You'd want to keep it in your mouth for a period of time to promote and support the good bacteria. The more good bacteria you have, the harder it is for those bad bacteria to survive. It's that simple. So oral probiotic is definitely a component in the plan of oral health that can lead to systemic health. Absolutely.
Wow, that's a huge point. And, I want to just talk a little bit more about xylitol, because I think when people hear the word xylitol, they're thinking, oh, that's some type of a man-made chemical. And you made a good point that, alluding in the last segment where you can find xylitol, that is naturally occurring in the body. And I just want to point out that there's been thousands, like we're big on research on this show, we're a science-based program, but there's been thousands of clinical studies done showing the benefit. And although we're talking about xylitol and somebody may be hearing it for the first time, especially when we're referencing the Spry dental line of products from the Clear company, xylitol has been around for a long time. It's not something that's just popped up in the last year. I mean, we've been talking about it for 6 to 7 years. Dr. Jones has been researching it for decades. So I just want, most times when people hear something for the first time, they'll think, oh, is that new? And it's really not, is it, Dr. Kammer? There's a lot of good research behind xylitol.
Absolutely. It's been around for, decades and decades. And there have been studies done that have actually shown that the cavity reduction power of xylitol. And when I talked about how xylitol, like it's when bacteria consumes xylitol, but then it can't metabolize it, so the bacteria sort of breaks open and it dies and it releases the xylitol again, and the xylitol can go on and have that impact on other bacteria as well. So it'll reduce the levels of bacteria of this tooth decay causing bacteria in your mouth, and far beyond the actual use. But that brings me to the point where I need to talk about the actual use, because some people may think, oh yeah, I chewed some xylitol gum today and I should be fine. But the studies have shown, and the studies have been done with situations where you use xylitol 5 times a day. In other words, the mantra, if you're going to use xylitol and you want to do the best thing you can to make it almost, and I'll say almost, but gee whiz, it's hard to get a cavity if you're a regular user of xylitol, but you got to use it 5 times a day. So we say strive for 5. Nice. In other words, 5 servings of xylitol a day, whether it's in the toothpaste that you use, whether it's in the chewing gum you use, and always watch for chewing gum that is 100% sweetened with xylitol. The Spry products are, but there are a lot of products out there that will say they'll make a big deal. They go, oh, we have xylitol in our product. Watch out, because a lot of those products have xylitol as a component, but it's way down on their list of sweeteners, and it's not as impactful at all. In fact, some of the other sweeteners might even be decay-promoting sweeteners.
Wow.
Go for the 100% xylitol, and that's going to be your best bet, and strive for 5. Okay.
Strive. Dr. Kammer, you're the best. We love having you on the show. You're just on such a wonderful mission. I mean, your main goal is to really help people, and you've always kept dentistry fun. I want to give you the floor. We got about 2 minutes before we have to say goodbye to you. Our time went way too fast. What would you like to leave with our listeners today about our discussion that we had?
Well, absolutely learn more. Definitely go to the links on your website. Check out that study. Learn more about xylitol. And if your dentist isn't on board or your hygienist isn't on board and they think that you're bleeding or your gum disease is okay and they're still going to sign you up for another 6-month cleaning or preventive care, challenge them and say, if I have disease, how come you're still giving me a preventive procedure that is not designed to, get that disease under control? If you've got disease, you need therapy. You need to go deeper. You need to employ tactics to get into the deeper areas where the worst bacteria exist. That's not a 6-month cleaning. And if you have bad bacteria, and by the way, the worst bacteria lives in the deepest part of the pockets where your brush and floss can't even reach if you've got 3 millimeter pockets or more. So ask your dentist, do I have, pockets greater than 3 millimeter? Show me my chart. Can I take a copy of my chart home? I want to see the measurements on all of my teeth. Not commonly done in a lot of dental offices. So I'm trying to empower your listeners and the public at large to demand a higher level of care so that they will stay forever young. They will live better. They will live healthier, have a longer life. So thank you for giving me the opportunity to be on Forever Young this morning. I appreciate being with you, Kelly and Carrie, and I support what you're doing with your radio program. So more power to you and more power to your listeners. You don't have to accept what the medical world will deliver to you. If we empower people to take back personal responsibility for their own health, that's the only way to go forward these days. So amen, and go for it, people.
Wow, you're a blessing, Dr. Kammer. I hope you'll come back on the show. We'd love to pick your brain about some other things. And for the listeners, we just want to remind you the Spry dental products like Spry gum, mints, toothpaste, and oral rinse are all available at Vitamin Shop, Whole Foods, Sprouts, and other fine retailers nationwide. You can also get it at Kroger stores nationwide now, which is fantastic. If you'd like a complete list of retailers, just go to the website. That's xlear.com, Xlear, xlear.com, and check out what we've spoken about today and learn more about xylitol.
Just understanding the importance of what he's talking about is probably paramount. And in trying to do the things for our health that we all strive to do every day. If you don't understand oral health, you don't understand how to get your body healed.
Really appreciate that you take the time each week to listen to our show. Be well to yourself, and we'll catch you next time. Make sure you check out the website, foreveryoungradio.com.